Hi, I'm Krista Carlamusto, founder and owner of Private Health Physical Therapy and Wellness. I am a physical therapist and a pelvic health specialist. If you are watching this video, chances are you are interested in or have questions about pelvic floor therapy. So what is pelvic floor therapy? Specific treatments performed and targeted to the pelvic floor. So I guess the more appropriate question is, what is the pelvic floor? Pelvic floor is a group of muscles right at the bottom of the pelvis that kind of create this supportive hammock. This is an example of a female pelvic floor. The orangish red material represents where the pelvic floor is. Even though this is a female model, men also have a pelvic floor. Pelvic floor supports the pelvic organs of the bladder, the uterus if you have one, and the rectum. It is also extraordinarily important for bladder health and urinary control, bowel health and bowel control, sexual function and orgasmic potential, and it is the floor of your core. So it works with other muscles in and around the pelvis to help with spinal stability. So it's an extraordinarily important muscle group that is often overlooked, unfortunately. So how do you know you need pelvic floor therapy? Well, if you have some of the typical symptoms, that might include loss of urinary control or urinary leakage, urinary urgency and frequency, loss of bowel control and fecal smearing, pain with sexual intercourse and penetration, persistent vaginal pain or pelvic pain, and even lumbar and sacral pain that aren't really responding to traditional physical therapy treatments could have a pelvic floor component. Other reasons to seek out pelvic floor therapy is after a major life event, such as being pregnant and having a child. So if you've had a vaginal delivery or even a C-section, there has been trauma to the pelvic floor, and it is worthwhile to seek out physical therapy for the pelvic floor as part of your postpartum care. Also, another life event is menopause. As you're going through menopause, there are huge fluctuations in your hormones. The loss of estrogen can greatly affect vaginal tissue and pelvic floor function, potentially leading to a lot of those dysfunctional symptoms, such as urinary incontinence and even pelvic organ prolapse. Other reasons to seek out pelvic floor therapy is if you have other diagnoses such as endometriosis, interstitial cystitis, irritable bowel syndrome. These are very specific diagnoses that have their own symptom patterns. However, it can be correlated strongly with a very dysfunctional pelvic floor that can often worsen those symptoms. So pelvic floor therapy might be able to help in those cases. So if you've identified that you have a dysfunctional pelvic floor, what's the next step? You can talk to your physician about getting a physical therapy referral for pelvic floor, or you could also reach out to a pelvic floor therapist yourself. I often guide potential clients on what they need to do to be able to see me. Once you make your initial assessment, what can you expect? Well, you can expect a very comprehensive evaluation, often including an internal assessment. So why do we do an internal assessment? We, as physical therapists, have to seek out the dysfunctional area of your body, and this muscle group just so happens to be within your body. And so we do an internal assessment to directly assess what the pelvic floor needs. Is it always necessary? Not really. It's ideal, but if you have some hesitancy regarding an internal assessment, you need to let us know. There are alternative ways to assess and treat pelvic floor dysfunction, with the understanding that your progress might be a little bit slower if we can't directly work on the pelvic floor itself. So pelvic floor therapy is often up to an hour, maybe more per session. There's a lot to do, a lot to treat, and a lot to talk about. I see my clients maybe 1 to 2 times per week, sometimes 1 to 2 times per month. So it depends on the severity of your symptoms and what you're able to do on your own at home. If you have any questions, I really recommend speaking to a pelvic floor physical therapist. We are extraordinarily approachable. And we will answer almost any question that you have. We understand that this is a very personal area, and we approach treatment very gently, with a lot of grace and a lot of respect. So don't be afraid to seek out this treatment. It's well worth your while. If you have any further questions or concerns, do not hesitate to contact me. You can call me or email me, and I will answer any questions that I can. Thank you for your time, and I hope to treat you soon.